Gimbel of Calgary, Alberta, and I have with me Dr. Ibrahim of the Catholic Medical Center in New York. We're discussing phacoemulsification of the hard nucleus. First, the lens is stabilized with the second instrument, and then deep central sculpting allows fracturing through the posterior plate of the lens. When the instruments are deep in the lens, this fracturing is more efficient. Alternatively, a lot of the upper portion of the nucleus can be sculpted away using a technique called downslope sculpting. Then, additional segments are fractured and either left in place or emulsified as they are fractured. Larger segments can also be divided with the two instruments. This animated graphic will demonstrate downslope sculpting, which is that little nudge of the nucleus to allow the sculpting to occur in the upper portion of the nucleus. This allows reaching the posterior pole of the lens more efficiently and quickly. Now we'll go to some surgical footage to illustrate these techniques and variations of them. You see hydrodissection being performed here with a 26 gauge cannula or a 30 gauge cannula. I find the 26 gauge cannula allows a larger flow and better hydrodissection. Here you see the sculpting just a little to the right. Actually, one can vary that depending on preference. But because the second instrument is stabilizing the nucleus, it's usually a little to the right of center where the sculpting occurs. Then in that notch we can put the tip of the second instrument to push the nucleus down to sculpt the upper portion of the nucleus. You can see how the spatula was pulled away from the tip and then replaced to nudge the lens. In soft lenses, the sculpting can be accomplished in just about 3 or 4 passes, but you see that in this dense pernescent lens, we have to be much more patient and just progressively shave deeper and deeper into the nucleus. You can see that centrally now we're quite deep, and once we are that deep in the lens, we can attempt fracture, but if it does not fracture, one could then sculpt more. Now you see that is a July 91 tape, and I didn't do as much downslope sculpting as I now do, and the fracturing occurred in the inferior portion of the nucleus rather than through the entire nucleus, because the upper portion of the nucleus had not been sculpted. This is the classical crater divide and conquer technique, leaving the segments in place. You can see that additional sculpting can be accomplished or performed as we rotate the lens around to reach other portions of the lens. And the additional sculpting would be to allow the phaco tip to get deep enough into the nucleus for efficient fracturing, because if the tip is embedded in the nucleus superficially, it's difficult to fracture the nucleus.
How do you avoid rupture of posterior capsule with this dense nucleus in your vision without a good red reflex?
We have to stay in the thickest part of that nuclear fragment and only use a short burst of phaco just to burrow into it or lollipop into it to fracture, and then once the segment is divided, to pull it into the center here where the phacomulsification takes place. So if one is always shaving as we sculpt, then the tip does not break through unexpectedly into the epinucleus and close to the capsule. Here you see an example of a larger section that I'm trying to divide now into smaller sections. So once the phacotip is burrowed into that segment, then the second instrument can be used to fracture it away. It's also used to stabilize the segment, to try to keep it from tumbling up against the cornea. We have a cushion of epinucleus here, but you can't really rely on that for safety because the epinucleus aspirates and emulsifies so quickly that if you occlude the tip near the capsule, the epinucleus will not be much of a safety factor. Where it is a safety factor is if the fragment is tending to tumble, then it would cushion it from cutting the capsule. When the fragments are loose like this, reducing the power can help to avoid the lens being pushed away from the tip by the excess power. So lower power at this point, if you have surgeon control, keep the foot light and even turn to lower settings of maximum power to achieve a feather control, and just pull the fragment to the tip and emulsify it gently. At this point, you may see me putting the tip of the second instrument under the phacotip, particularly once the epinucleus starts coming in, to guard against the capsule unexpectedly coming up to the tip with shallowing of the chamber. So this is so-called epinucleus, and this will vary from very soft material to very firm onion-like shells of nucleus in denser lenses. Here you see the spatula under the tip to avoid capsule coming up against the tip. You also see these small capsulorhexes due to the poor visualization with this dense lens. In this graphic, you will note the depth of the phacotip indicated on the right-hand side. To illustrate that the sculpting has to go very deep in the lens, and then the nudging step to allow the sculpting of the upper portion of the nucleus. And then after deep central sculpting, the fracturing can occur with instruments deep in the lens. Illustrated now in this surgical video. The effective stabilization occurs with the second instrument in the center, so the initial sculpting is a little bit to the right of center. And one can emulsify more of the upper nucleus, almost in an L-shaped pattern of sculpting. And there's the initial fracture. Once deep in the lens, the subsequent fracturing occurs without pre-grooving in this density of lens. When we get to much more brunescent nuclei, we will note that pre-grooving can be helpful and even necessary. The more firm the lens, the more likely I am to leave the segments in place, because it facilitates fracturing of the remaining part of the nucleus. Also, when the zonular ligament is very lax, I will tend to leave the segments in place to keep the endoskeleton of the lens capsule in place while the fracturing is accomplished. Many times a lens of this density can be removed, and then the capsular bag, unsupported by zonules because of weak zonular ligaments, will start to collapse, particularly as the cortex is stripped away from the capsule, or an attempt is made to strip it away. It just pulls the capsule with it. So here you saw multiple fracturing and then removing each segment after all of fracturing has taken place.